Hello, my name is Claire Dwyer, and I picked lymphoma for our 486 project. This green ribbon represents the lymphoma awareness, so that's why I picked it for the front. What is lymphoma? Lymphoma is a name for a group of blood cancers that develop in the lymphatic system. It's a cancer that affects lymphocytes, which are a type of blood cell that travel through the blood and lymphatic system to defend the body against bacteria, viruses, and other things. They develop when a change occurs with a lymphocyte. For example, it could either replicate faster or live longer than a normal one, which makes it abnormal. Cancerous lymphocytes can travel through the blood and lymphatic system and also spread throughout many parts of the body. The most common ones are the lymph nodes, spleen, bone marrow, and other organs. Two major types of lymphoma is Hodgkin lymphoma and non-Hodgkin lymphoma. And the bottom picture is the stages of how a lymphoma can progress. So first, what is Hodgkin lymphoma? It's a lymphoma that involves the Reed-Sternberg cells. They're distinctive giant cells found from a biopsy and usually derived from B cells. And B cells mean that they have not undergone hypermutation to express their antibody yet. Usually, Hodgkin lymphoma starts in the lymph nodes and spreads to another lymph node or to another organ. It's a lot less common than non-Hodgkin lymphoma, and approximately 9,000 people are diagnosed in the U.S. each year, most commonly diagnosed in young adults from the ages of 15 to 35 and in older adults over 50. It can occur in both children and adults, but it's most common in adults, and the most common signs are swelling of the lymph nodes, fever, night sweats, unexplained weight loss, and lack of energy. So non-Hodgkin lymphoma is any lymphoma that does not involve Reed-Sternberg cells. There are at least 86 types of NHL. Not a single disease, but a group of several closely related cancers called lymphoid neoplasms. They're all similar but different in some features, and they either differ in their appearance under the microscope, molecular features, and growth patterns. So their impact on the body and how they respond to different types of treatment as well. Approximately 80,000 people are diagnosed in the U.S. each year, and it's the seventh most common cancer affecting adults. It has nearly doubled between 1975 and 2013 in how common it is. So genetics and prevalence. The cause of most lymphomas is still not known. Because there are so many different types of lymphomas, they often cannot pinpoint the cause. Family history is definitely associated with an increased risk for all lymphomas. For non-Hodgkin, it is a 1.7-fold elevated risk, and for Hodgkin, it is a 3.1-fold elevated risk. There are new therapeutic regimens that have begun to delay the numbers of deaths related to lymphoma, especially for non-Hodgkins. More men are diagnosed with lymphoma than women, and non-Hodgkin's, which was in the previous slide, is much more common than Hodgkin's. A family history of a specific subtype is most strongly associated with risk for that specific subtype. And the most common type of NHL is B-cell lymphoma. About 90% of people in Western countries have out of all of them. So the risk factors, the ones that are italicized, are the ones that are common on both sides. So for Hodgkin's, it's weakened immune system. Age most often occurs in young adults, 15 to 35, or late adulthood. Family history is 5% of cases, and previous infection with EBV infection or mononucleosis. And then for non-Hodgkin, immune system deficiency, age, most common in older adults, family history, previous chemotherapy or radiation, and exposure to certain chemicals like pesticides, benzene, and herbicides, which are the most common three, and either infection with HIV, HVC, or EBV. So this is under a microscope the look of a Reed-Sternberg cell, which means Hodgkin's lymphoma. And as you can see in the picture, it's very large and very noticeable under a microscope. And this is a B-cell lymphoma, which is the most common type of non-Hodgkin's, which is a huge B cell, which you could obviously see under the microscope as well. So symptoms for Hodgkin lymphoma: painless swelling or lymph nodes in your armpits or groin, Persistent fatigue is the most common one for both of them. Fever, night sweats, unexplained weight loss, severe itching, or increased sensitivity to the effects of alcohol or pain in your lymph nodes after drinking alcohol. Many of them are very common to non-Hodgkin's lymphoma, and when someone is experiencing these symptoms, they often do not know if they even have it because these symptoms are so common or which one it is. The doctors have to usually take a very distinct test to figure out which one it is. So, symptoms for non-Hodgkin's lymphoma is enlarged lymph nodes, chills, weight loss, fatigue, swollen abdomen or a lot of vomiting, feeling full about a small amount of food, chest pain or pressure, shortness of breath or cough, severe frequent infections, and easy bruising or bleeding. So, B symptoms, which is the most common form of non-Hodgkin's lymphoma, are specifically fever, which can go on for several days or weeks without infection, drenching night sweats, weight loss without trying, and as you can see, many of these are very, very similar to the Hodgkin lymphoma symptoms as well. So the diagnosis for both are very common too. The diagnosis for Hodgkin lymphoma, a physical exam checking for swollen lymph nodes, blood tests to see if the blood can indicate the possibility of cancer, imaging tests, which could include an X-ray, CT, or PET scan. Removing a lymph node for testing is usually the most common because they may recommend a lymph node biopsy to diagnose abnormal cells, which would be those Reed-Sternberg cells, and to also look for abnormal cells in removing a sample of bone marrow. And for non-Hodgkin's, physical exam as well for swollen lymph nodes, blood and urine test, which is different than Hodgkin's, to rule out the infection or disease, imaging tests to look for tumors, because most often for non-Hodgkin's, unlike Hodgkin's, you do have tumors somewhere in your body. So to look for tumors using X-ray, CT, MRI, or PET scan. And lymph node test, which is the lymph node biopsy to see those abnormal cells as well. And a bone marrow test to also look for those cells too. The effect of lymphoma on exercise response. In most cases, although exercise is good for patients with lymphoma, many patients are able to do less exercise while having it. One of the most common side effects of even just having lymphoma and plus the treatments is weakness and fatigue. So this results in feeling more tired, therefore doing less activity. And exercise is prescribed in order to maintain strength in most cases, not gain it, because there the patient can keep up with normal tasks and activities, because especially having treatment for lymphoma, which is usually chemotherapy, you are very weak and fatigued all the time. So balance is often an issue for patients with lymphoma due to fatigue. So a stationary bicycle is often recommended instead of a treadmill or something else. You're very prone to injury due to weak muscles and bones from treatment, which needs to also be taken into consideration. And it is very important to use FIT principle in assessing patient with lymphoma, but it must be modified and begin much lower than usual, then build up on. For example, the frequency for aerobic exercise is normally 2 to 3 days a week, but someone with lymphoma or getting treated for it might want to start with 1 to 2, and small activities for aerobic, like walking upstairs or just having a 10-minute walk. And also to be careful for a heart rate to quickly rise. Since exercise is much more difficult with someone who's receiving treatment, their heart rate often quickly spikes, which is common too. The exercise prescription for someone with lymphoma is aerobic exercise, improving physical functioning, quality of life, even for people who are undergoing chemotherapy. A lot of the benefits are increasing muscle and bone strength, controlling weight, lowering fatigue, which is the most common one, reducing your risk of infection while you're on treatment, and reducing your risk of developing blood clots while on treatment, and increasing overall physical well-being and enhancing mental well-being and relieving stress. Mental health is very important for a patient, especially while having cancer. A lot of doctors believe that if their patient has a positive mindset, their treatment and overall prognosis will be a lot better. Physical activity often benefits mental health, especially stress, which is a main reason that doctors enforce exercise for their patients. With this being said, if some patients are getting a lot of chemotherapy and are very weak, even a walk down the hall each way and back is considered physical activity. It all depends on the diagnosis of each patient. So exercise prescription, the amount of exercise depends on different factors: your doctor, your health, if you're participating in treatment or not, your diagnosis. So many doctors prescribe exercises that are also everyday activities. For example, walking, climbing the stairs, carrying grocery bags, gardening, or light exercises you can even do at home while you're sitting down, since often you're so weak. They prescribe to us to often start very slow and build up. So start maybe a 10-minute walk 3 times a week and then add 5 to 10 minutes on those. Maybe take the stairs instead of the escalator or the elevator more than once or twice a week. And it's very important, especially if you're going through treatment, that energy and strength are maintained throughout it, since treatment often makes the patient very weak and tired. So the common forms of treatment, chemotherapy is the main method. It's given intravenously or orally to kill cancer cells and decrease chance of tumor spreading or returning. And chemotherapy is the one that increases the survival the most. Radiation therapy is high energy radiation used to kill cancer cells and shrink tumors. Targeted therapy involves antibodies that recognize and bind to the surface of cancer cells, delivering a direct dose of cancer-killing agent to that specific cell. And stem cell transplant, diseased bone marrow is replaced with the patient's unhealthy stem cells or stem cells from a donor in order to help grow new healthy bone marrow. The overall 5-year survival rate for Hodgkin lymphoma is 86%, and the overall 5-year survival rate for non-Hodgkin's is 71%. So this is the case study I have. It's a woman who's 79 years old, history of congestive cardiopathy and myocardial ischemia. Recent history included hospital visit for abdominal pain, and a solid abdominal mass was discovered. Her risk is she's very high risk due to her age and medical history. Goals, treatment will be very harsh for the patient due to age and prognosis. It's very important the patient participate in our aerobic activity daily to maintain strength. And since she is elderly and the treatment is very intense, small aerobic activities like walking, taking the stairs are recommended daily. The mass was 10 centimeters, which was discovered as non-Hodgkin's lymphoma, large B cell. The clinical exam did show no signs or symptoms, though, which was unusual. And since she's very high risk, since it's very high risk in her age, she has a very short life expectancy, which is about 12 months. And it is very harsh for someone this age. So it's important that she balances and maintains her strength, balance, and motivation throughout. So daily aerobic exercises are very recommended. Exercise testing. Every person who has a form of lymphoma can react differently and have their own unique experience and response, so it must be medically cleared. Patients with cancer should ideally receive an assessment of all components of health-related physical fitness. Everyone needs to start usually light intensity walking or progressive strength staging, which is very common for lymphoma. Often the treatment patients receive can affect their organs and body, so professionals must be very aware of this. For example, if you have a chemotherapy can often affect a heart of a patient, so they must be set up to an EKG machine during it. And the FIT principle is commonly used by cancer patients, but needs to be reduced to a level that is better tolerated. And the reason I picked lymphoma is actually because my sister was diagnosed with Burkitt lymphoma in 2009 when she was 10 years old. This past February, she has been a cancer survivor for a decade and is now in the survivorship program. She had the least common kind of cancer and was sick for 2 weeks, and they actually figured out that there was a tumor in her stomach. So this is why I picked this and really enjoyed learning more about it. Before my sister was diagnosed, I honestly have not heard of it, and all the new technology, the cure rate is getting higher and higher, which is really great. Thank you for listening to my presentation.